Have you ever wondered how a complete human being develops? From just a tiny cell inside the mother's womb? From the beginning of conception to the moment of birth, thousands of changes take place inside a woman's body. Changes that we cannot even see from the outside. While the baby growing inside the womb develops day by day, the mother's body continuously adapts itself to provide that tiny life with nutrition, oxygen, and protection. Today, we will understand this journey. In simple language, from conception to childbirth. What exactly happens to the mother's body and the baby inside the womb? Pregnancy begins when a sperm cell from the male and an egg cell from the female meet. This process is called fertilization. After fertilization, the newly formed cell begins to divide rapidly and, within a few days, travels toward the uterus. There, it attaches itself to the inner lining of the uterus. After fertilization, the newly formed cell begins to divide rapidly and, within a few days, travels toward the uterus. There, it attaches itself to the inner lining of the uterus, and a special hormone called HHGG is produced to help maintain the pregnancy. This is the hormone that is commonly detected by a pregnancy test. The first few weeks of pregnancy are extremely important because the basic structures of the baby's body begin developing during this period. At first, the embryo is extremely small, inside it is incredibly rapid. Gradually, the brain, spinal cord, heart, and other major organs begin to develop. Within just a few weeks, the heart begins its activity. During this time, the mother may experience tiredness, increased sleepiness, nausea, vomiting, breast tenderness, or frequent urination. However, every woman experiences pregnancy differently, and some women may have very mild early symptoms. As pregnancy progresses, the embryo gradually begins to take shape. The arms, legs, fingers, facial structures, and other parts of the body begin developing. During this time, the placenta, a special organ connected to the umbilical cord, also plays a very important role. The placenta helps exchange nutrients, oxygen, and other essential substances between the mother and baby, while also helping transport certain waste products produced back into the mother's circulation. Through the umbilical cord, the baby remains connected to the placenta. This entire system is extremely important for the baby's development inside the womb. By the second trimester, many women begin to feel some relief from the nausea and tiredness experienced during early pregnancy. The abdomen gradually becomes larger, and the baby continues to develop rapidly. The baby's bones and muscles become stronger, and the baby begins moving inside the womb. After some time, the mother can start feeling these movements, which many women describe as one of the most special experiences of pregnancy. During this stage, regular prenatal checkups are very important because doctors monitor the health of both the mother and the baby and may recommend ultrasounds and other tests when necessary. During the third trimester, the baby begins gaining weight rapidly, and the organs become more mature and prepared to function after birth. Inside the womb, while the uterus continues to grow larger. Because of these changes, the mother may experience back pain, swelling in the legs, changes in sleep, shortness of breath, or frequent urination. As the expected delivery date approaches, the mother's body gradually begins preparing itself for labor and childbirth. And then comes the moment that has been awaited throughout the entire pregnancy, the birth of the baby. Labor begins when the muscles of the uterus start contracting. These contractions may gradually become stronger, more regular, and closer together. The cervix gradually dilates so that the baby can pass through the birth canal. Pregnancy begins when a sperm cell from the male and an egg cell from the female meet. This process is called fertilization. The safest method of delivery depends on several medical factors, including the condition of both the mother and the baby. Even after the baby is born, the process does not immediately end. After childbirth, the placenta also separates from the uterus and is delivered. The mother's body then begins going through another series of hormonal and physical changes. The uterus gradually starts returning toward its pre-pregnancy size.
Pregnancy is not only the story of a baby's development, it is also the story of the incredible transformation of the mother's body.
Throughout this entire period, maintaining balanced nutrition, getting enough rest, taking medications and supplements as recommended by a doctor, attending regular prenatal checkups. Every woman's pregnancy experience can be different, so another person's experience should not guide yours. And not ignoring unusual symptoms are very important.
If there is any concern or unusual symptom, consulting a qualified doctor or healthcare professional is always the safest approach. The body is carrying out an incredibly complex and extraordinary process of development. A journey that begins with a tiny cell eventually leads